regular basis for a number of years and became a very strong supporter of the works that we had done. But what we realized is that when people begin to bring down the impact of federal policies down to the local level, you can hold your elected officials accountable. And you can bring groups together who normally were competing with each other for money. And they begin to work together. And you can begin to get some good media out of that. So ever since then, we've used that analysis and that way of doing things to set up our organization that basically has worked with probably 20 or 30 major national campaigns around housing, education, living wage jobs, etc., and bring that information down to the local level. And I suggest that people check out our website, nationalpriorities.org, and take a look at the kind of information we have on your community and on your school system. We've got a database with a lot of information, and we're involved. The biggest thing that we're involved in right now is taking a look at the cost of war and what that war costs local communities. But we've been able to get that information onto a number of national audiences. We've been on CNN, we've been on McNeil NewsHour, NPR, and so on, because people begin to see that this kind of information really is quite amazing. So I encourage people to do that. But the larger thing that I'm trying to get across is if you've got local information, you can begin to really develop very interesting dialogue with your members of Congress. I'd just like to say a little bit about the crisis that we're in right now, and to recognize that we are in a fiscal crisis. And as Jen pointed out, there are 29 states right now that are facing fiscal crisis. The total amount of those crises is about $47 billion. Maryland will have an $808 million shortfall for this coming budget year. It's having both cut budget programs and increased taxes. So it's having an impact right here locally. And it's not just here in Maryland, New York. The school system alone is $1 billion in debt. San Francisco, $229 million deficit. Vallejo, California has gone bankrupt. You can see these are just within about 5 minutes of Googling city budget crises, the kind of information I was able to get off the web. So it's not just happening here in Maryland, it's happening all across the country. While some people may say, well, really, maybe that's just the economy right now, maybe things are going to get better. But in the years that I've spent working with communities across the country, I've seen a much different situation, even before the crisis. A third of the schools in this country either need to be replaced or substantially repaired. A quarter of the bridges in this country are functionally obsolete or need to be substantially repaired. 38 million people live in poverty. And we've done work in places like Detroit with a 47 or 48% child poverty rate, Atlanta with a 43% child poverty rate, Milwaukee with an over 40% child poverty rate. I work in Springfield, Massachusetts right now, a 42% child poverty rate. Hartford, 41% child poverty rate. Think of that. Think of that. Think of 4 out of every 10 children in the community living in poverty. And I think that's totally true concept. We know that we've got critical environmental crises, and we've got 47 million people without health insurance. And just to give you some sense of that, we have 9 million children without health insurance. And I did a little bit of calculating, and I figured if each child who doesn't have health insurance held hands with another child so that they were standing like this in a line, that line would run from Bangor, Maine, down to Boston, New York, across Pennsylvania, across the Midwest, to California, to San Francisco, down to Los Angeles, back across the United States, and back up to Bangor, Maine again. Wow. That's amazing. If we could think of that. That's a child every 3 or 4 feet, all the way through. If we then added up the adults who have no health insurance, we would have people standing like that, making 5 trips across the United States. It's more than the circumference of the world. So I'm face to some of these numbers. So when we talk about people without health insurance, it's an enormous amount of people. I want to talk just a little bit about what's happening between cities and the federal government. Because I know that that's been an issue with a lot of elected officials and with a lot of communities. Sometimes people say, well, what's the connection between the federal government and our local community? Should this be something that we should be concerned about? Isn't it up to the, it's not really our business. Well, I've been involved a lot with working with local elected officials, and here's what I found. Back in 1980, there was a major shift in funding, where before, money was coming directly from the federal government down to the cities. And if you took a look at all the cities across the board, about 15% of those city budgets came from the federal government. Well, federalism came through, and then they cut that money down to 5%. So it's now, cities now get about 5% of their money from the federal government. But not only did they cut the money from the federal government down to the states, so that you have to deal with the state officials, they cut the amount of money that's actually going to the states as well. So, for instance, between 1980 and 2000, if you added up all the spending for state and local aid, states and communities lost $1 trillion. $1 trillion in 20 years. $1.2 trillion was added to the Pentagon. So there was this major shift in money. So I really think that, federal spending, some of it went to the states, but it was cut back. And really, in many urban areas, larger urban areas, who were a lot more dependent upon federal spending, they lost very, very much money. So, basically, HUD money, housing money was cut by 60 to 70%. Job training money was cut by about 3/4. Social service money was cut significantly. Daycare money was cut. Those kinds of programs were cut quite dramatically. Maryland in 1980 got $1.2 billion from the federal government. By 1999, it got $0.6 billion. So its money was cut in half. And really, this trend continues today. Whoop. That might be what happened. There we go. Give you some sense of what's happening. That the bottom, this line represents domestic spending. And as you can see, it increased a little bit from 2000 until 2005, and then is beginning to go down. Military spending has gone up fairly consistently, and you can get some sense of what the trajectory is. So if we think things are going to get better, the numbers don't look like that. And as you begin to take a look at future projections, you're going to that the government has developed, the gap begins to increase more and more.
Thinking about that slide, I find is the strong line on the bottom. Yeah.
Right. Wow. It's flat. We had earlier talked about this. This is money that goes to development aid, especially, and you can see that it is relatively flat, and I'll get to that in a second about how we define national security. But one would think that there are different approaches to national security that might go up, and that really has not done. So this is really where your tax dollar is going. And I'm sorry this chart doesn't show it quite the way you did, the way it should, but you can see about 33 cents going in one way or another to military spending. And the blue represents the direct Department of Defense, the Department of Energy, nuclear weapons. Veterans benefits represents about 4 cents. And the war represents about 5 cents of our income tax dollar. Healthcare